Hello. Thinking about doing foster care or matched adoption, which is what we're working on. Um, basically, I'm just going to talk about some of the stuff that they're going to be asking for, because some people, when they get involved with an agency, they're thinking like CPS or something like that. If you're doing foster to adopt or foster care, you're probably going to be dealing with CPS more regularly. And even when you're doing matched adoption, there might be some, a little bit of some CPS stuff going on, in regards to checking on the child that's in your home. But it's also not going to be about, like, they're going to ask you a lot of information, but it's not going to be, to question you about your parenting. They want to find out like what your parenting style is, but they're not going to question you in regards to like, are they going to take my kid away? Things like that. So some people don't want to get involved. I know families sometimes when their kids when their family members go into CPS, they don't want to get involved because it could be scary. So just some things first. So first I'm going to talk about some of the trainings that you have to do. So you do have to give a lot of information, but the training is the first thing that they're going to have you do to move towards licensing. So I'm just looking at my binder here that I created so that I could be organized. So there's going to be some trainings that the agency may be very specific in offering, and there's going to be some trainings that we're going to talk about that are more for any agency whatsoever. They're not like agency specific. So we did Ask Community Helper training from Ask, which is Ask About Suicide to Save a Life. So we did that training, and that was agency specific. There's also trainings from the Texas Department of Family and Protective Services. So I'm in Texas. And these can be done on your own. You don't have to be with an agency. You can do them and have them ready for whatever agency you decide to work with, for psychotropic medication for children in Texas foster care. If you do not have that training done, you cannot administer medication, and your respite care provider or babysitter cannot do that unless they have that training, and they may need some additional trainings as well. Okay, medical consent training for caregivers. So you are provided medical consent for that child when you have them in the home, and this is going to be for like when you take them to the doctor, the dentist, emergency room, things like that. You'll be given that documentation when they first are placed in your home. That's also found in the Texas Department of Family and Protective Services. These are free trainings to take. There's also a training for Need for Normalcy, a training for foster parents. That's the title. And that's also found on the Texas Department of Family and Protective Services. It is free, and they give you a certificate at the end of each one of these trainings that you can have, and it's good for a year, and then you have to update them. Some do not have to be updated depending on the age that you're looking for. The trainings that we're doing are for any ages, but if you're looking at getting preteens, then there's some trainings that you don't have to do, but then you have to do some additional trainings in some other aspects. There's also runaway prevention. This is also on the Texas Department of Family and Protective Services. And that is for regardless of the age. They make you do that at the beginning. And then if they want you to renew it, they will let you know, like, okay, you need to renew it. But at the beginning, it would be required regardless. You also have to get a certificate of achievement from the Texas Department of Family and Protective Services for mandatory reporting community response for youth and families. You are a mandated reporter, and that's important to know what to look for in order for you to make the adequate reportings. Also on the Texas Department of Family and Protective Services, you have to take trauma and trauma-informed care, an introductory training provided by DFPS. That's the title for that. Since we know that the children, the youth that are in foster care are going to have had some type of trauma, abuse, neglect. Another training that's on Texas Department of Family Services is needing to get a certificate of achievement for caregivers. The title is Caregivers Preventing and Recognizing Sexual Abuse and Victimization of Youth in Foster Care. So this is not only abuse from when they come into the system and they're removed from their families or caregivers, but also in regards to being in foster care. So we know that as foster parents that there are, in any field, there are good and, then there's people who make bad choices or who have kids in foster care and then they're moved from their placement because, something happened, and it doesn't necessarily mean that it happened like they caused it. It could be something that was caused under their supervision and could have been avoided, or there are no excuses. They're going to have to be placed somewhere else. So for the trainings for the agency, these are very typical for other agencies as well. The first one is emergency behavior intervention, and you go through the training, and after the training you are provided with a quiz. Some agencies want you to do a quiz for yourself and for your caregiver, for your spouse, your the other caregiver. If you're single, then you don't have to worry about that. But some agencies want you to submit both, one with your signature and one with your spouse's signature, or other agencies want you to submit one quiz from the both of y'all, which is ideal because it's a household, it's you as a couple, and it's y'all are signing up for this together. And of course, if something happens, that would be considered a major event, and so then that would have to be assessed. They do ask for pay stubs. They want to know that you're working, that you have other income coming in. I don't think that they ask more specific questions about that. Typically they ask for 2 pay stubs, or maybe something that shows what you've been making. They also have you do a foster parent orientation, and they'll discuss the organizational structure, policies and procedures, philosophy and programs that they offer, foster parent documentation, things that you're going to have to fill out that you need to know that are going to be due on a monthly basis or are due within 24 hours if something happens, emergencies, doctor's visits, those need to be turned in on a regular basis right after the signatures of the providers. Emergency procedures, what the protocol is, if something happens in your home or in another location, but with kids that are in your care, who do you notify and how soon do you have to notify and who else do you have to notify? Needs and characteristics of the children served, and overall of the minimum standards, the DFPS contract, and Youth for Tomorrow resources. Also, some discussing some common questions that people have in foster care and for adoption. Another training is about roles, guidance, and discipline. So discussing what the expectations are for each role, and how to within the guidelines, provide discipline to the child that's in your care. Personal safety. This is in regards to communication and guiding the children in your home to be safe. And, if they're feeling uncomfortable about anything, whether they're at school, at home, anywhere, that they feel comfortable to discuss that and have that conversation with them. Water safety, transportation safety. This is information mainly about when you're in a car, and what the seat belts and the different child car seats are that are appropriate for each age and weight of the child, and then knowing about what the rules and guidelines are. Having a kid in the front seat, they got to be 13, things like that. Cultural competency, so being culturally aware. There's, children in foster care that are from many different cultures and backgrounds, and so it's important to be aware of what their culture is, and awareness and acknowledgement of their culture, and being able to walk with them through that, because denying them that is also a form of abuse and neglect. Culture best practices. So that's something that kind of goes along with culture, but that's a very big aspect that has many components that have to be discussed. And so that one was a longer training. Cultural competency, covering cultural identity. So when you're of a certain background or culture, or you have certain beliefs or race, it's really important that if you have a child in your home that is not like you, or that may look differently or may believe differently than you, then it's important to take those things into consideration, and to also be flexible with their beliefs and without judgment, and provide space for that. There's also cybersecurity and internet safety. This is mainly for awareness, and also for the awareness of the children. So it may be a conversation that foster parents will have with the children in the home, and maybe provide some boundaries there. There's also a universal human trafficking prevention program. It's provided through this one was provided through the agency, but it is a part of the Texas Department of Family and Protective Services. So there's also one there that can be completed if needed. Serious incident reporting. That was a training. We kind of talked about that already, but that's important. 3 and 30. So there's a few things that have to be done within 30 days of the child entering your home. And that would be, doctor's visits, different assessments. They need to have their medical appointments, their dental appointments, their checkups. And they do have Medicaid, so they're not going to come into your home as a foster child with, like, you have to put them on your insurance, and it's a hassle, and because that's a big ordeal. That's not what happens. They come to your home, they have Medicaid, they have everything that they need, so that you can schedule those appointments in a timely manner and get those done. So they're already equipped with what they need to get those done in a timely manner. So nothing to hinder that. And then if they're adopted, if you're doing adoption, then they get to keep the Medicaid, and they have other, different benefits that they get to keep with them. Some are college, some are subsidies that continue to help them have, resources, if need be, considering, counseling, or whichever maybe the reason that they need some additional services. Evacuation. So looking at those major events that could happen in the home. Shaken baby, abusive head trauma. So talking about some of the statistics and going about like what are some reasons, not reasons, but some circumstances that have happened that have led to shaken baby syndrome or abusive head trauma. Safe sleep for those babies that are younger than 1. Developmental stages of children, discussing that, and what is ideal for them in regards to play, socializing, and doing extracurricular activities. Also medications, storing, administering, record keeping, and disposal. So when they do your home study, they'll go a little bit more into detail about actually implementing and observing how you will be implementing medication, safety in your home. And so the training is to discuss that before somebody actually goes into the home. Illness and disease prevention. So this is about, anything from the common cold to communicable illnesses. That's why they have you do the TB testing. If there's anybody in your home that's over 14, they'll ask for them to be tested to confirm that they don't have TB. They also go over adverse childhood experiences. These are questions like any past trauma, physical trauma, neglect, anyone who's been incarcerated. So some of the youth will have higher AC scores. As foster parents, we have our own AC scores. There are certain things that we've experienced, and so it's important to be able to identify what your experiences are that could have been traumatic, and how that can, knowing yourself better and being self-aware and working through those things make it a lot easier for you to be able to have children that have had trauma, different or similar to yours as a foster parent, and being able to work through that. Because sometimes if you've gone through a similar traumatic experience, then you could be butting heads with the child because you're in your trauma cycle, and you're going through and handling things the way that you know how to, based on past experiences. So trauma training for caregivers. This is talking about providing a safe environment. They go into how you can best support the child in a positive manner, even though they may exhibit emotional, behavioral, or physical problems. That you have to be able to discuss it all so that you feel more equipped talking about, those things, and especially, or if nothing's happening and they're being triggered. Secondary traumatic stress. This can be a result of someone who has experienced trauma firsthand, or secondary trauma. That can also happen. Compassion fatigue. So checking the reasons why you're doing foster care, why you're doing adoption, and making sure that you're not doing it for, different reasons that could be considered unhealthy, and can cause you to be easily triggered. And, because if you're feeling like, okay, I'm going to be a hero and do foster care or adoption, they need the assistance of someone who knows that life is hard, and that you're not a superhero, and that you can walk through it together, and they're seeing you in your very transparent manner. Another thing that's on the Texas Department of Family and Protective Services, there's many forms, but one of them is the disaster plan for DFPS foster and adoptive homes. This is going to be something that you have a plan for if there's a disaster, what's going to happen if something happens to your home, or like if your home is flooded, or if your home goes on fire or something like that, something major, what would you be doing and where would you be meeting? So then you have a disaster plan in writing, but then you also have a picture somewhere near the front of the house, so that everybody in the house knows what the map looks like and where you would be meeting, and that will illustrate the rooms in the house, what buildings are in the backyard, where the street is. And before there's an actual home study where somebody comes out to look at your home to confirm that it is a safe place and that you're ready and prepared for the foster child or children that are coming. You do have to do a fire inspection with the fire department. We were able to do it here in our town, and you need to have a fire extinguisher, and it needs to be weighed and ticketed, like with a tag. And we had one, but it was it hadn't been checked recently, and so we were informed of a place that actually had one that they would give away for foster families in in a close by town. And so we were able to get that. That was a blessing. And so not having to pay for it is great, and it's a great resource. So the fire department comes, they test the fire alarms, check to see if you have a fire extinguisher. They check that there's no like major hazards. It's a very quick walkthrough, nothing to be nervous about. You just want to, be mindful of the, cords and, electrical stuff, that you don't have too much going on there. And then you have a health inspection. Some counties don't do it. Some cities, towns don't do it. So then the caseworker who is working your file will go through your house and, see what you got. And usually what they're looking for is that you have a home that looks like, you've been living in it, and that it's clean, and they're not looking that it's like spotless. They're looking for a home that looks like a clean home, and that there's no like pests. They also want to look at your medications, where you store them. They want to look at, if you have guns. The bullets have to be locked up separately than the guns. And the medication, sometimes you have refrigerated medication, so you want to have a little lockbox for that. If it needs to be double locked, then you want to have a double locked, so one in the other in the refrigerator. And then same thing with the ones that are not in the refrigerator. It could be over-the-counter medication, it could be ointment, it could be creams, any kind of topical, anything that contains some type of aid medication, then it needs to be locked up. And when you're dealing with mental health prescriptions, those typically have to be double locked. And so then you need to have, you could have a toolbox that has a lock in it, and then on the inside you specifically lock the mental health medication in its own lockbox. And I'm not sure what they call it, but it's it's a different grade of medication. I can't think of the word right now, but it has to be double locked, and so they're going to be looking at that. And so that kind of relieves your tension a little bit, your anxiety, knowing that they're not going to be looking for, did you dust your blinds today? So that's mainly the majority of the documentation and different things that they're going to be looking at when you're a foster parent moving towards doing foster care, foster to adopt, matched adoption through foster care. You may do some different things if you're doing like private adoption. I'm not too sure about that aspect of it, but I think that basically covers the majority of it. When you do have a house home study, they'll ask you a bunch of questions. It's going to be like, what is your preference for the kids that you're wanting to have in your home? And I'll probably make a different video about that because we have looked at some websites where they have kids, and they'll go deep into the history of yourself as a child, your teenage years, your adulthood, and then also going over marriage, and then parenting your children. And they'll have questions for each child in the home that lives in the home. If there's a child that has moved out and they sometimes visit for an extended amount of time, then they may ask that child to do a background check. And I think that that's the extent about that. And usually nothing else is needed for the adult child that doesn't live in the home anymore. But there will be conversations of a lot of questions with extended detail. If you're somebody who just, spills the beans and just, talks really well and is able to have, full sentences, then you're probably going to be fine. It's not going to take a long time. It could take, for yourself alone, it could be 3 hours. For your husband, it could be 3 hours, and then together with the whole family, could be an hour, and then with the child or each child, it could be 30 minutes to an hour, and that's kind of what happens during a home study. We haven't had our home study with this agency yet. We have fostered in the past, but it's been almost a decade since we've done that, and the home study process may have changed, but the questioning is pretty typical for a home visit. There may be some virtual conversations and discussions and questions that are done over Zoom, and then less questioning when you're in person, and it's more about the review of the house and just asking some questions about the family as a whole unit. And then that may be when the questions for the child are asked. And so when we go through that, I will try to provide a more updated information, but those are the basics. And so I encourage anyone who is thinking about fostering or wants to foster or wants to do direct matched adoption through foster care, I highly recommend it. And it's something worth doing, looking into. You could get a placement and decide you want to close your house after that placement is gone. That's okay. You can do that. You don't have to do it for years and years and years. Some people do that. That's a preference, but that's not required.